Dr. Marcet, March is obviously Colorectal Cancer Awareness Month. What is things you want people to take away from this awareness month?
It's to have that conversation. Have you had your colon cancer screening?
Well, let's jump into that a little bit, because the age for screenings, according to the American Cancer Society, was 50.
Yes.
You worked to lower that to 45, right?
Yes. Yes, so about 10 years ago, we did a research study where we looked at the National Cancer Database and noticed that over a 20-year period from 1986 to 2006, we saw a steady rise in the rate of colon cancer in people younger than 50 at every age group, age 20 to 25, age 25 to 30, and so on. By the time we got to the age group between 40 and 50, there was a doubling of the rate of colon cancer. So in 2006, there was twice as many people with colorectal cancer younger than 50 than in 1986 in this country. Shocking that a disease would rapidly rise like that. Since that paper was published, there have been other investigators from other academic health centers showing the same. In other words, meaning that that trend has continued, where colon cancer rates are going up in people younger than 50.
Why?
And so that led to the National Cancer Institute recommending lower the screening age for colon cancer from where it was previously 50, now 45, and I suspect it's going to lower more.
And why do you suspect that?
Why is a good question. Well, in our study, we saw that every age group it had gone up. And so we're still seeing it in people younger than 45 in a very large proportion, people in their 20s, their 30s, and their early 40s. Why is a good question, and we don't have the answer. There's a lot of changes in our environment in the last 40 years. You know, is this environmental? And you can just go down a list of, you know, the way the food's produced, the way the food is stored, you know, the use of antibiotics, the use of plastics, the use of fertilizers, you know, you name it. It could be any number of things, and maybe more than one, you know, of these causes that put together is causing an increased risk, but we don't know exactly why.
There has to be signs, right?
Yes. So the signs for colon cancer are what doctors say is non-specific, meaning it could be abdominal pain, belly pain. It could be blood in the stool. It could be changes in how you use the bathroom. So those are signs that can happen for many other reasons. You could have bleeding for hemorrhoids, for example.
Sure.
And many people will say, oh, you know, it's just hemorrhoids. Actually, bleeding is never normal. So if there's bleeding, there's blood in the stool, it should be investigated. It shouldn't be written off. And so I would advise anyone that has blood in the stool, talk to their doctor about it. And more so, if the doctor's saying, oh, you know, it's probably just hemorrhoids, which I hear sometimes, unfortunately, don't settle for that. Just say, well, you know, I'm worried about colon cancer because I hear it's common. And go ahead and ask for a screening test.
I will say the first time I went to the doctor about it was 2002, and I said there's blood in the stool, and he chalked it up to maybe a hygiene issue or hemorrhoids and said don't worry about it. I didn't get it checked out again until 2021, and now we're at stage 1 colon cancer, right? So if you don't get the answer you think you should have the first time, what do you recommend?
So what you've said is actually very common, that a person may see a doctor or may even talk to a friend and they chalk it up to, say, a hemorrhoid or some other condition. And you know what? It may very well be that.
Sure.
But you don't know unless you have an investigation. An investigation is to look inside.
Yeah.
So, yeah, I mean, sometimes you had to be your own advocate and say, no, I hear colon cancer is common. Why don't we just do an exam for peace of mind? I hear that story way too often.
Do you?
Yeah, the person's having blood for months at a time.
In my case, years.
Years at a time?
Yeah.
Yeah.
What is the best way to prevent colon cancer then? Is it obviously a screening?
Well, I think it's being knowledgeable that this is a common, it starts with that. It's awareness. This is a common cancer. You ought to know your family history. If, for example, you know that you have a first-degree relative that's had colon cancer, that increases your risk. So if you take the average risk in this country, it's about 6%. So it's roughly about 1 in 20 people gets colon cancer in their lifetime, slightly higher. Okay, if you have a first-degree relative with colon cancer, your risk of colon cancer is now 10%. So it went from 5 to 10, it doubled. Okay, and then there are families that have high risk of colon cancer, where we see it generation after generation, and those risks are very high. They're 50%, sometimes 100%, depending on what that condition is. There are people that they're predetermined they're going to get it at a young age, and so we especially want to learn about those families because we want to screen those people early. So again, if you're an average risk person, your family has never had colon cancer, you should be striving to have your first colonoscopy at age 45. However, that's called a screening colonoscopy. Okay? Screening means you're having no symptoms. If you're 35 and you're seeing blood in the stool, you're having a symptom that could be colon cancer. Again, you don't know until you look. Why not have peace of mind and take a look?
Great point. Colorectal cancer is the third most commonly diagnosed cancer in the United States, and it's the second leading cause of death from all cancers. So if it's so easily treatable, what's the big disconnect?
Yeah.
Why aren't people...
If you take women, it's the third most common. If you take men, it's the third most common. When you combine the population, it's the second most common cancer. The takeaway is that this is a cancer that can be prevented. Prevented. Not just cured. I mean, if you have it, you want to be cured. And it is a highly curable cancer, stage dependent, but it is a cancer that can be prevented because 99% of the time this cancer starts out in a polyp. So a polyp is an abnormal growth of the colon, and before it becomes cancerous, it's just this what we consider benign growth. If you remove that benign growth, then you stop the progression into a cancer. And that's why people are recommending, once they have a polyp, they're asked to come by 3 to 5 years later to check again. Because generally these are slow growing tumors when they're polyps. Once the cancer forms, then they grow at different rates. Some are still slow, some can be very fast.
But if it's so easily treatable, why aren't people getting screened? What's that disconnect?
That's a great question. There are people that just will not have it done. They're saying, no, I'm doing fine, I don't need that. But they're not understanding that you need it while you're doing fine to make sure you keep doing fine. There are people that just won't do that. There are people that don't go to the doctor. There are people that won't get vaccinated. There are just people that say, no, that's not for me. Over 70% of the people do get screening. So, but there is that smaller percentage that don't. Now, we've been talking about colonoscopy as a screening tool. And some people just don't want to do a colonoscopy, so there's another way of screening that does not involve a colonoscopy.
Is it 3D imaging or?
No, it's using a sample of stool to look for tumor DNA. It's called Cologuard.
Cologuard, yeah.
Yeah, and so for some people they'll accept that, but not a colonoscopy, to which I say, great, do it. It's a good test, and that's something. So colonoscopy for screening, if you're average risk, you don't have a polyp, is once every 10 years. So not bad.
No.
It's not like other things where you have to go yearly. So once every 10 years. Once you have a cancer, you're going to go more often. But the Cologuard you repeat every 3 years. And if it's abnormal, meaning they do detect tumor DNA, then you're going to be recommended to have a colonoscopy to see why.
Absolutely.
So I see today that's a test. I see patients that come to my office that have had an abnormal Cologuard test, and then they get their colonoscopy and their cancer is found that way. One important thing is if you find a cancer, let's say the person has no symptoms, and you do one of these screening tests and you find a cancer, almost always it's a very early stage cancer, highly curable. So again, you're looking to prevent, but if you happen to find a cancer, it's usually a very early stage and curable.
Now, the recent change in the ACS guidelines for colonoscopy, moving the age from 50 to 45, what age do you think that guideline should really be at?
So when we wrote our paper 10 years ago, 12 years ago, we said age 40.
40.
Yeah.
Now, if I was last year before the guidelines changed and I'm 44 and I waited to 50, what do you think my outcome would have been?
So, and did you say you had a stage 1 cancer? Congratulations. So it would have been a much more advanced cancer. Yeah, so what happens, this cancer is an abnormal growth of the inside of the colon. It's the inner lining. It's like our internal skin. Yeah. It protects us from the inside. And so the cells that make up that lining begin to grow abnormally. And once it becomes a cancerous growth is an invasive growth. It's growing into the wall of the intestine. Stage 1 means it's just starting to grow into the wall. But in time, it grows through the wall and spreads.
Into the lymphatic system.
Into the lymphatics, or also through the bloodstream. And so it can spread to other parts of the body, notably the liver and the lung. And so then that's more complicated to treat that. You know, those people require a lot more care. And then, you know, again, that goes back to where a hospital like Tampa General can be a savior for people with such advanced disease.
Yeah, like once they realized it was a cancer, I got a CAT scan immediately, and then they found lesions in my lungs. Okay. And so then now we have to go back and say, what is that?
Yeah. So yeah, the CAT scans are so sensitive today that they'll find little lesions, like in the lungs. And a lot of times we don't know what they are, so we'll say, well, let's repeat a scan in 3 months
That's
or
exactly
6
what's going on.
months,
Yeah.
and just to make sure it doesn't change.
So this was something interesting that I noticed, that if it was known that if my biopsies came back, which both times it came back negative, I would have started with radiation, but because it didn't, I started with a resection. Why is that? Why is it different? Why wouldn't you just want to cut it out?
Right, and you do, but the location of the tumor and its stage at the time that it's found will dictate how we approach the tumor. So really, the care is individualized to each person. Every cancer is a little different. Every colon cancer is a little different. So the location again, and so radiation comes into play for cancers of the rectum. So it's the same type of cancer, but the rectum is the last 6 inches of the colon. So the very low part of the colon, what we call the rectum, cancers in that area take some special precaution. And when the tumors have grown through the wall of the intestine, that's when we'll use radiation and chemotherapy up front before surgery. The worry with cancers of the rectum is could the person lose their rectum and end up with a permanent colostomy. And actually, if I may say this, we just finished a clinical trial that has been submitted for publication, and we hope in the next month or two it is published in the Journal of Clinical Oncology, that looked at changing the way we treat cancer of the rectum, the advanced ones, with radiation and chemotherapy, in hopes of avoiding a major operation, you know, a really radical surgery. And actually, you know, the study's not published yet, so I can't give all the details, but it's actually a very favorable study where we now are changing the way we treat rectal cancer, and more people are avoiding a colostomy. So it's wonderful, wonderful news.
Absolutely. So that really changes somebody's life. What are the top 5 ways people can prevent getting colon cancer?
Well, healthy life, it starts with you, right? So healthy lifestyle.
So less Tito's.
Yeah, less Tito's. So yeah, alcohol in moderation, not being overweight, exercising regularly. You know, all the things you hear about other health issues, it's the same, amazingly. You know, it affects your health in so many ways, colon cancer being one. Eating, you know, lots of fruits and vegetables, particularly green vegetables. Having a diet that's low in meat, and that's all meats.
Even fish?
No, fish is not a meat.
Thank you, good, because I love the red snapper out of here.
So meat would be beef, pork, chicken, lamb, game, all that's considered meat. Fish is not. And actually, the World Health Organization about 3 years ago came out with a statement that processed meats, are carcinogenic. Just like cigarettes can cause lung cancer, processed meats can cause colon cancer. They actually have made that statement from the World Health Organization. Now, so to that I say everything in moderation, right? Don't eat bacon every day. Don't eat ham every day. Use everything in moderation. Enjoy it once every 2 weeks or once a month if you want to have a bacon. But the other things, so how you treat your body is one, and then colon, knowing your family history, colon cancer screening, or all the very important ways you can treat you can try to prevent colon cancer. But even if you're very healthy and you do all the above, you still need to be screened.
Sure.